Welcome to the Explainer. You know, we think of therapy as a place to heal, right? But what happens when the very software of therapy is, well, completely incompatible with the mind it's supposed to be helping? Today we're going to dig into why a super common therapy approach might actually be really harmful for people whose minds have been fractured by trauma.
So, let's just jump right in with a pretty tough question. Can therapy actually be harmful? I mean, what happens when a tool that's supposed to heal you ends up causing more damage? What if that place you're told is safe becomes the very source of misunderstanding and even neglect? Okay, so to really get this, we're going to use a metaphor that I think makes a lot of sense. Think of therapy as a piece of software and your mind as the computer's operating system. Now, almost all standard therapy is designed like software for a single mind OS, one single unified consciousness. But for someone with dissociative identity disorder, or DID, their mind is totally different. Trauma has forced it to develop into a multi-mind operating system. It's not broken. It's a brilliant survival strategy where consciousness is split up into different parts.
And that, right there, that's the core of the problem. See, most therapies out there are built on this one huge, unspoken assumption that the therapist is talking to one person, one continuous consciousness with one single timeline of memories.
But here's the thing. DID isn't just some personality quirk. It's a condition called structural dissociation. And this is super important. It's not a choice. It's a deep, neurological adaptation to survive horrifying trauma. The mind literally partitions itself into different parts, often called alters, to wall off what's unbearable. This lets other parts of the person keep going, keep functioning in day-to-day life.
There's this quote that just nails the experience. From the outside, you might look like a totally regular grown-up, but on the inside, it feels like you're a bunch of children standing on each other's shoulders under a trench coat, just desperately trying to figure out the world. It perfectly captures that disconnect between how you look and what's really going on inside. A whole bunch of different parts, different ages, different memories, all trying to work together with no instruction manual.
So, what happens when you try to run that single-mind software on a multi-mind system? Yeah, it crashes, hard. And there's no better example of this crash than what we can call the DBT trap.
Let's take a really common tool from a therapy called dialectical behavioral therapy, or DBT. Now, DBT is used a lot to help people manage really intense emotions. And a core part of it is the daily diary card. It's basically a worksheet where you're supposed to track your feelings, your urges, your behaviors every single day.
Seems simple enough, right? I mean, for a single-minded person, sure, it might be a bit of a pain, but it's a totally doable homework assignment. It's designed to build self-awareness. But for a mind built on structural dissociation, this simple task isn't just hard. It's an absolute setup for failure.
And here's why it's impossible. It all comes down to the neurology. The defining feature of DID is amnesia. We're talking thick, high walls between the different alters. So the part of the person, the alter, who goes to therapy on Tuesday, they might have absolutely no way to tell the other alters who are living life on Wednesday, Thursday, and Friday about this homework. Those other parts might not even know the diary card exists. It has nothing to do with not trying hard enough. It's a structural, neurological barrier.
And this is where it gets really damaging. The blame gets flipped. When the patient can't do this impossible task, the system doesn't see it as the tool being wrong. No, it sees it as the patient being wrong. Their inability to do it gets labeled as willfulness, resistance, or non-compliance. Basically, they're accused of not wanting to get better.
You see how this creates this enormous canyon of misunderstanding, right? The clinician might write in their notes that the patient has fair insight, meaning they kind of get that they have alters. But what's really happening inside is that the patient's system has this incredibly sophisticated, deep understanding of how all its parts work, and it's amazing at detecting subtle threads. So the issue isn't a lack of insight at all. It's the sheer difficulty of communicating that complex internal knowledge across those amnesia walls to someone on the outside.
And this mismatch, it's not just some frustrating setback in therapy. When the software and the operating system are this fundamentally incompatible, the crash isn't just a blue screen. It causes real, tangible, and sometimes life-threatening harm.
And the misunderstanding just snowballs from there. Think about the very core of DID, switching between alters. An untrained therapist doesn't see a neurological shift in consciousness. They see a mood swing. They see emotional dysregulation, something that needs to be stopped or controlled.
This reframing has, well, it has really chilling consequences. It completely dehumanizes the patient. These alters, which are literally traumatized parts of a person, like fragments of a child who need care and safety, they get reframed as risk factors. They become liabilities that need to be managed instead of survivors who need to be healed.
To make things even worse, the symptoms of DID can change on a dime. One moment, a person can be incredibly distressed, and then snap, a different alter who wasn't experiencing that distress switches in, and they seem perfectly calm. A clinician who doesn't get it sees this and thinks, aha, they must be faking it. It's a total invalidation of the person's entire lived reality.
And this right here is where the damage can become absolutely catastrophic. Because when every single thing a person says, whether it's about emotional or physical pain, is seen through this warped lens of behavioral problems or attention-seeking, what happens? The real, legitimate physical health problems get completely ignored.
Just think about this harrowing, real-world example. There was a patient who was reporting physical symptoms for months, but because their chart was full of psychiatric labels, every single complaint was just brushed off as anxiety or some kind of delusion.
And the result? They ended up in the emergency room, hospitalized with a 104.8-degree fever. It was sepsis, a life-threatening infection. That was the objective, undeniable proof. The story the doctors had been telling themselves wasn't just wrong, it was incredibly dangerous. Dismissing this person's physical reality, it almost killed them.
So, all of this really hammers home one critical point. When you're dealing with a condition like DID, getting specialized, trauma-informed care isn't a preference. It's not a luxury, it is an absolute necessity for survival. Because when you try to force a multi-mind system to act like a single mind, you're not just using the wrong tool. You are actively re-traumatizing them. You're teaching them the exact same horrible lesson that their original trauma taught them. You have to hide parts of yourself to be safe. You have to pretend to be someone you're not to be believed or accepted.
And that pushes people into this state of just profound isolation. It creates that feeling of being a guest in my own house. Can you imagine? Trapped inside yourself, with your real experience completely invisible and misunderstood by the very people who are supposed to be helping you?
So we kind of end up right back where we started. It shows that using the wrong tool, even if you have the best intentions in the world, can be unbelievably destructive. When you run standard therapy software on a multi-mind OS, it doesn't just crash. It can turn a place that's supposed to be about healing into a source of even more trauma. And maybe that's the biggest takeaway. For the most fractured minds, the first step to healing isn't trying to fix the patient. It's about finding the right tool for the job in the first place.